My colleague Susan Gregg Schrader suggests that there are 5 things that we can do as congregations to develop mental health ministry. We can do education. We can help make people aware of the range of these disorders and some of the issues that go along with them. Just as we talk about other health issues in the life of the congregation, we can do education about mental health issues. We can make a commitment institutionally as congregations to mental health ministry by forming a mental health team in the congregation. And I'll talk about the specifics of that towards the end of this morning. We can overtly and intentionally welcome people into the life of our community who are struggling with a mental health disorder. Let me just share with you, I was doing a training in a suburb of Boston some years ago, and it was held at a local church, and as I walked up to the church, over the doorway was a sign that says, welcome the joyful. I personally have suffered over the years with depression. And I thought about all those times, particularly as a young man, where I was not joyful. And I looked at that sign and I said, I wonder if I fit here. That's simply, it's the beginning of welcome. What are you doing? Literally at the door. What signs are there? What indicates that you and your congregation understand that people are vulnerable to mental illness and you're welcome here? Maybe it's as simple a thing as putting up a sign or two about the National Alliance on Mental Illness and its programs. Or sticking in the bulletin, we welcome healing prayers for all sorts and kinds of conditions, including depression or substance. What do you do that indicates a welcome? A third aspect of a caring congregation is to provide service. We're going to talk specifically this morning about providing companionship, speaking to and addressing that need to overcome isolation. But what kind of resources, support groups, and spiritual care and practical ministry can we offer to those who are struggling with mental health issues? And finally, what can we do with our community partners to assure that our community mental health services and programs are readily accessible and fully effective? I sat on the bus coming back yesterday from the APA Convention Center with a doctor who is in charge of an inpatient unit in Vancouver, near Seattle, where I'm from. And he was talking about the fact that there used to be a 5,000-bed hospital in the province of British Columbia. And then it was reduced to 500 beds, and then it's now reduced down to 39 beds for long-term inpatient care for those who are most difficult to serve, people with a limited number of people, but very real number of people that have issues with violence or just are not able to really at all care for themselves in a community setting. And he said, we're down to 39 beds. In the state of Washington, where I come from, we're 900 long-term inpatient psychiatry beds short. You and I can do everything possible in the lives of our parishes to welcome and encourage and serve, but we also do need to partner with that wider community and develop the social supports and healing resources that the whole community has a responsibility to provide. So those are, if you think about a caring congregation, you're doing education, you're making a commitment to this work of mental health ministry, you're visibly and intentionally welcoming individuals and families into the life of the community of faith, providing some basic services and doing advocacy. One of the resources if you want to pursue this notion of a caring congregation more fully. www.mentalhealthministries.org. They have a web page, a monthly newsletter, the Spotlight, printed resources, and videos. If we did nothing else, but I stopped here, and each of you went to that website in the next few days and took one resource from mentalhealthministries.org and used it in the coming year, I would consider this gathering a success. So there's a basic online resource for you. I want to talk about 3 areas for doing education in the local congregation. You know, I know that presenters will say things like, do this, but then you say, yeah, well, but how? Let me just spell that out a bit. You can do education in mental health ministry through premarital counseling and in marriage counseling. Let me give you a very concrete example. As a clergy person, I learned to do a certain amount of premarital counseling before I performed a wedding. It never occurred to me when I first started doing ministry to ask the couple to talk with me a little bit about their emotional mental health history. But over time I began to do that because I realized that that's part of who we are as persons. Our history emotionally, psychologically, in terms of mental illness. And so I just began to ask out front, have you or others in your family struggled with a mental health issue? Your partner? If you or members of your family struggled with a mental health issue? So that at the beginning of a life together, a couple is talking about that dimension of life. They may be 1 in 5, the 4 or 5 families that don't have a family member who struggles with a mental illness, but they may also be ultimately the parents or the children of 1 in 5 families that do have a history of mental illness. So in premarital counseling and in marriage counseling, at least raise the issue, is mental health a concern in some way? And might it be helpful to have a colleague from the mental health field available at some point? The Georgetown University and their Center on Children and Pediatric Care developed the Brighter Futures curriculum. They shared with pediatricians around the U.S., in this case, a set of resources that pediatricians and family practice doctors could share with parents, just some mental health tips for parents of newborns and infants, parents of toddlers, parents of preschoolers, parents of elementary school kids, parents of adolescents. And each set of materials talked about some of the most basic psychological mental health issues faced by parents and children at each age. And one of the things we did with Pathways to Promise, and it's still in progress, we've developed a set of resources using that Brighter Futures material to share with clergy and congregations. You have a small packet that you could hand to the parents of newborns that has a letter from you as a congregational leader saying, we celebrate with you the birth of your child. We also want to be with you in the journey of parenting, and here are some resources that are helpful to that. We'd like to invite you in this next year to a gathering of other parents of newborns and infants to talk about what it means to parent and what some of the mental health issues are that come up for parents and children. Can you imagine in your parish or congregation, your church, synagogue, mosque, that each year you just have a time for parents of newborns to talk about some of the mental health issues at each developmental stage. What a gift to your parishioners, your congregants, and to the wider community. You want to grow a church? You want to grow your congregation? Once a year, offer a mental health resource for parents at various stages of the developmental process. You don't have to teach it as a parish religious leader, a congregational leader. Invite one of your mental health neighbors, a social worker, a nurse, a doctor, psychiatrist. Come and be a visiting lecturer at St. John's by the gas station for parents of newborns and toddlers. And the same thing through the lifespan. I won't go into all of the areas, but you see where I'm going with that. The second thing that I think we can really focus on fruitfully in the life of congregations is to do some basic education about the human brain. It's the most complex organ in the body by far. Billions of cells. We can learn about what some call the triune brain. Have you ever seen this, the brain in your hand? You just make a fist with your thumb under. This is the brain stem, the reptilian brain, the early brain, where a lot of the basic activities of life, your heartbeat is monitored, and a certain level of instincts are active. Base brain. The mammalian brain, the brain of emotions, the seat of feeling and mood deep in the brain. The cerebellum, the thinking brain. I love this. When you flip your lid, when you're angry or upset, you're acting out of your emotions, your thinking brain may not be online all that well. You say to someone, "Oh, be reasonable." No, part of my brain that's reasonable isn't quite there right now, so I may have to calm down, walk around, get some of my basic brain working. That's just a little bit of brain education. We can talk more about what goes on with the emotional, the heart brain. That aspect of our brain where memories of feeling are located. We can talk about, just the spiritual practices of breathing and its help to the brain, just to calm the basal brain. One of the things I do when I'm working with people is just try and keep in mind, before I can talk about theology or have a cogent prayer, we may need to use the spiritual practice of breathing just to get the body and the being ready for conversation. And then I raised the question yesterday with our psychiatric colleagues. We've got this amazing body, this complex brain, this capacity for mind, imagination, thinking. What's it all for? I've begun to talk about what I call the spiritual brain, the whole brain, my brain linked with yours, able to have and experience moments of faith, to develop worship and social life together, community. So these are just tastes, I think, of how some education about the brain can help us deepen our appreciation of our faith, our beliefs, our practices. Because often what we're using in our spirituality is this complex body, brain, mind. So let's learn about it a bit. Doing education about the brain